agenda should call 669-900-6833 and use meeting ID number 987-0899-4173, and then press pound, then pound again when prompted for participant ID. Again, that number is 669-900-6833, and the meeting ID number is 987-0899-4173. So, Mr. Clerk, would you please call the roll?
Certainly, Mr. Chair. Councilmember David Rue.
Oh, present.
Councilmember Mito Farrell.
I am present.
Councilmember Terrence Rice.
I believe he will be joining us late, so he is not here yet.
Okay, you have a quorum, Mr. Chair.
Thank you, Mr. Clerk. And at this point, I'd like to open up to public comment and remind those who have called in to please state your name and the items you would like to speak on when you're prompted to do so. So, do we have any speakers? Andrew, first caller.
Caller, please state your name and the items you would like to speak on.
Hi, this is Jay Feldman. I'm Executive Director of Beyond Pesticides, with membership in California, Los Angeles, and based in Washington, D.C. Let's see, the number I guess I need to give you, the file number on this is, let me grab it, file number 18-0788, which pertains to pilot projects for park land management. Thank you for taking up this piece of legislation.
You have 1 minute.
We'd like to support the legislation for a number of reasons that go to public health issues, particularly timely legislation because of COVID-19, and given the disproportionate impact on people of color communities, black and brown people, and given the exacerbation of risks associated with pesticide exposure to issues like asthma, respiratory distress, and immunosuppressive diseases, this legislation is particularly important in light of disproportionate risk and what we're referring to as environmental racism. People of low income use parks more generally because they don't have access to private land areas to the extent that higher income people do. We are prepared to stand with you as a city council and offer services to the city that can share the information that's been experienced across the country in terms of transition to organic land management, natural cycling of nutrients, reduction or elimination of toxic pesticides and synthetic fertilizers. And this program not only... Thank you.
Next caller, please state your name.
Hava Danielson. I'm an architect, and
which item would you like to speak on?
Item number 8.
Okay, I'll give you a minute. Go ahead.
I'm here to express my strong support for the motion introduced by Councilmember Krikorian's office. Expanding access to child care has been an important issue for a long time, but now more than ever. Clearly, in light of our current situation, it is now the time to act. We have the public will, and the focus is on the importance of child care in expanding economic opportunities throughout the city and to allow all people to work and participate in our economy in the way we need them to. And child care is part of that, and it's been notoriously difficult to open child care centers for all kinds of reasons, and this motion begins to address those in a very constructive way. Thank you, and please support this motion. It's an important step forward. Thank you.
Thank you. Next caller, can you please state your name and which items you would like to speak on?
Good morning. Michael Shilstone with Central City Association. I'd like to comment on item 8.
Sure, you got a minute. Go ahead.
We're very supportive of the motion to make it easier for early childhood education facilities to open in Los Angeles. In May, we published a white paper focused on expanding opportunities for ECE in schools in downtown LA. And we're pleased to see that two of our key recommendations are reflected in this motion. One which would streamline approval processes, and another which would explore the use of public parks to meet child care facilities requirement for outdoor space. We've also submitted a letter to the file offering additional suggestions for promoting these facilities, including enabling schools by right in areas that lack them, incentivizing the provision of ECE facilities in new developments through tools like the density bonus, allowing more flexibility for existing buildings to be converted to ECE in schools via adaptive reuse, and considering using city-run libraries for ECE. We believe access to ECE in schools is a critical issue for downtown and for our city, and is even more important now amid our economic recovery. We're committed partners on this issue, and we're very grateful for Councilmember Krikorian's leadership. Thank you.
Thank you. Could I get the next speaker and what items you'd like to speak on?
Yeah, Nick Griffin with the Downtown Center bid, speaking on item 8.
Go ahead, you got a minute?
Great. I strongly support Councilman members Krikorian's motion to make it easier for early childhood education facilities to open Los Angeles. Child care is a critical neighborhood asset, and these are smart reforms that will increase access to ECE. ECA has long been needed and is even more important now to rebuild our economy as parents go back to work. Supporting child care can also be a path to economic opportunity for historically disadvantaged communities, as the industry is disproportionately made up of women, particularly women of color. I also encourage you to consider additional ways of expanding opportunities for child care in schools, like creating by-right process for schools and neighborhoods where they are needed, incentivizing the provision of ECE facilities in new developments, better enabling existing buildings and spaces to be adaptively reused for ECE in schools, exploring the use of libraries for ECE, and I would like to thank Councilmember Krikorian for his leadership on this issue. Thank you.
Thank you. Could I get the next speaker and which item you'd like to speak on? Next speaker?
Hello? Can you hear me?
Yes. Could you state your name and the item number you'd like to speak on?
Yes, it's Eric Previn, and I'd like to give a comment on a number of the items.
Okay, which ones?
1, 2, 3, 4, 5, 6, and 7. And
all right, I'll give you 3 minutes for all the items.
Okay, thank you. So, first of all, I just want to talk about the Prop 68 grant. The Board of Recs and Park Commissioners have done a report about the Santa Monica Mountain Conservancy Prop 68 grant for the proposed Tahunga Greenbelt, which...
2, and then it's general comment.
What's that?
Oh, I'm sorry, go ahead. Go ahead, Eric.
Oh, okay. It sounded like you were having another conversation, but okay. So the problem with the Prop 68 is it's a big bond that we passed, and the money for water project-related things is being earmarked. There was an effort to spend $8 million, $7 million in our neighborhood at the local rec center called Beeman Park to put the cherry on top of a Frankenstein project that has been sneakily cobbled together by insiders and Paul Krikorian and I guess Wendy Gruhl even, to expand our city rec center into a high school regulation basketball court, which is in nobody's interests except for obviously some private high school somewhere. Hi, Harvard Westlake. But they're busy with their own monstrosity over on our publicly accessible recreation facility called Weddington Golf and Tennis, which is not just a treasured part of a community, but also even a historical kind of a landmark. I don't know that it's been officially designated because the official designation process is driven by thieves and crooks like Steve Afriot, who got the Sportsman's Lodge de-designated even when it had been designated by the great Ken Bernstein, who wrote up the report, the seminal report saying Sportsman's Lodge should be protected. At which point Afriot said, let's not rush to any judgment while I stuff through what can now be seen at the corner of Coldwater and Ventura being erected, which is not what we got what we signed up for. It's much larger. It looks like the May Company on the corner of Studio City. It's bad, very, very bad. So I apologize for those who have to endure that.
Speaker, please go into your general public comment.
My general public comment? Okay, this morning, or yesterday morning, Mayor Garcetti went on the Today Show to talk about, where we are in the COVID crisis. And he said, it's very hard to know what to say because people should be protecting themselves and their families by doing the right things and socially distancing and wearing the masks. But people are, also tortured by this process. So what does he say? He says, we're not going to turn things into a police state. Now, the problem I think that has been bubbling up is that we already have a kind of a police state. And that's what I would say about the rest of the agenda, that we've got to focus on the key aspects of getting through this as opposed to hyper-regulating and trying to kind of litigate through endless motions that are confusing. I mean, why, for example, are Blumenfield and Koretz involved in the mutation and mitigation measures for pediatric inflammatory multiple?
Thank you for your comments. Your time
You're
is
welcome.
up.
Thank you, and that ends general public comment. So that was the last caller. And colleagues, if there are no objections, I would like to recommend that we move items 1 through 5 on consent and continue item 7 at the request of Councilmember Koretz.
No objections here.
Thank you, Mr. O'Farrell. At this point, Mr. Clerk, can we move to take a vote on these items?
Yes, Mr. Chair. Councilmember David Rue.
Aye.
Councilmember Mitchell Farrell. Aye. Councilmember Karen Price. I think he's not in yet. So it passes, Mr. Chair.
Thank you, Mr. Clerk. So I actually would like to take it out of order. I know we have 2 items, item 6 and item 8, but I'd like to start with item 8. Mr. CLA, can you read item number 8 into the record, please?
Sure. Item number 8, motion, Krikorian, Martinez, relative to the early childhood education programs and approval process for child care facilities, also referred to the Planning and Land Use Management Committee.
Thank you. And I just wanted to take this one out of order because I know we had a lot of callers call in for general public comment, and I do not intend to have a full-blown discussion on this issue that is before us, and this motion has to report back. But I do want to take this opportunity to make a few remarks about the importance of streamlining and funding child care services in our city and throughout the state. In my view, this motion isn't just about the approval process for child care facilities, because child care across the country is in crisis, particularly in the wake of COVID. We've seen some acknowledgement of that in D.C. and Sacramento, but this industry, which was already underfunded and undersupported, is facing real uncertainty with this pandemic. Some experts estimate that nearly half of all the child care slots in America could disappear by the time the pandemic is over, and we are feeling this crisis here in Los Angeles. Nearly 40% of child care centers in the city have shut down since this pandemic started, and without continued funding and support as our economy tries to reopen, these closures could become permanent. Unfortunately, most of the discussions happening now is just about saving child care centers, more than it is about expanding them. Thankfully, the legislature and the governor recently agreed to walk back the proposed cuts for child care in the next year's state budget, but there is more that we can do here in Los Angeles to help out existing providers and expand child care facilities and services, and this is one of them. And I really want to thank Councilmember Paul Krikorian for his leadership, and our council president and the rest of the city council. So with that said, I look forward to having this discussion when the reports come back, and if Councilmember O'Farrell has any comments or questions on this item.
Thank you, Mr. Chair. I'll just say that I think it's also a great initiative that the access to early education and child care from a very, very young age is essential in all communities, and especially in light of the hyper-awareness of the traditionally underserved communities how critical this is going to be moving forward. Early education, childcare from a very young age is absolutely necessary if we are to expand job and career opportunities to parents of very young children so they can enter the marketplace. It's all about creating opportunities so people can advance in society, especially in light of our all-in approach to dismantling institutions of racism. I think so in light of the zeitgeist and what's happening now, there are elements directly tied to the lack of child care in our traditionally marginalized communities. So this couldn't come at a more important time, and I also want to commend Mr. Krikorian for introducing this. Thank you.
Thank you, Mr. O'Farrell. Well said. And with that, I'd like to recommend that we approve this item. So, Mr. Clerk, can you take a roll call vote, please?
Councilmember David Ruth,
Yes.
Councilmember Mitchell Farrell,
Aye.
Councilmember Karen Price, if he's still not in.
So it carries?
Yes, sir.
Thank you, Mr. Clark. Could you now read item number 6 into the record, please?
Yes. Chief Legislative Analyst report relative to the wearing of masks in public.
Thank you. And I want to thank Councilmember Koretz, who is here joining us, the maker of the motion, as well as I know we have various staff online. Tristan Noack from the CLA, Carmina Di Santiago from the Emergency Management Division, and Dr. Don Tarashida from Department of Public Health, LA County, Deputy Director for Acute Communicable Disease Control. So, colleagues, you know, when this matter was initially being considered by the council, it was before the mayor took action to mandate the wearing of masks in public, as well as the governor's recent mandate to wear masks in public as well. There were still plenty of unknowns, but what we do know is that wearing masks in public can slow the spread of virus and protect Angelenos. Since the state, the county, and the city staggered openings went into effect, we've seen a significant increase in the number of infections, especially putting elderly residents and people with underlying conditions at risk. So on June 18th, the governor issued a mandate that all Californians wear masks in public, with a few exceptions. Today, we have city and county staff with us to talk about where we are in the term of infection rates, how we're managing the pandemic, whether the residents are adhering to the governor's order, and the city and county's enforcement of this order, and what steps are needed to be taken to reduce the rates of infection. And I really want to thank Councilmember Koretz for being a leader on the mask issue. I have joined them in several legislations together, but now I'd like to turn it over to Councilmember Koretz to make a few remarks, and then we'll go into some discussions with the CLA report and where we are today in terms of the governor's order, the city, the counties, and the cities and counties' response to the ongoing pandemic. So, Mr. Koretz, the floor is yours. You're on mute. Can someone unmute, Mr. Koretz?
Oh, I got it. How about now? Okay. Well, thank you for including me today, Mr. Chair. I want to thank our county health department for doing an amazing job over several months to keep us all safer and to keep us flattening the curve as much as possible, considering the hard political and economic realities. I wish we had all been able to stay at home long enough to really end the pandemic, but obviously that's not possible. We know how devastating this has been economically, and unfortunately a vaccine is not on the horizon yet. My goal all along is to ensure that we can open safely. I truly can't fathom the people who have politicized mask wearing. This is literally, for some people, a choice that will mean life and death, and sometimes a choice between the life and death of other people. As infections continue to rise to record highs around the country, it seems like we should start to consider it reckless endangerment of others to not wear a mask. Studies more recently have shown that in a circumstance where two people would exchange the virus, that if you wear a mask, that gives you about 30% protection. If you both wear a mask, the estimates of spread in that circumstance are as low as 1%. So it clearly makes a difference between starting to reduce and eliminate the virus and continuing as we expand to increase the spread. Now, obviously, when I originally introduced this, after considerable research, a number of countries had implemented this, but the city of Los Angeles hadn't. And I appreciate the mayor taking the initiative and implementing it. But we've had some difficulties. We've certainly noticed as we expand our reopening, restaurants in particular have not done well in terms of being able to implement the protocols correctly. We've gone out to around 3,700 now, I believe, and it's been around 50% non-compliance, which is clearly problematic. We obviously had a lot of exposure during the civil unrest as demonstrators in the early stages, although they seemed to figure it out after a while, were largely unmasked, and many LAPD were as well. That, along with reopening in so many places and not doing it perfectly, clearly has increased the number. Now, my understanding is that reopening hinges on whether or not counties have kept their new cases in the last 14 days to less than 25 per 100,000. And I'd like to ask County Health how close we've been to that in the last 14 days.
Hi, sorry, I was trying to take myself off mute. Can you hear me?
Yes.
Hi, it's Dr. Terashuda. Thanks for having us. I don't actually have I'm sorry, were you asking for our rate? So currently, we've been tracking our numbers. You can see our numbers that are on our dashboard on our publichealth.lacounty.gov website. We are tracking a number of different metrics as we slowly reopen the county in a staged approach. You can see our numbers there on the dashboard. I don't have the rate per 100,000 ready at hand. I could get that, but our numbers per day, as you mentioned, I agree, have slowly been tracking upwards. This is probably due to a variety of different reasons, but we do think that the reopening of the county and the circulating of probably the people within our county now has contributed to this in a great manner.
Without a doubt, we are above the rate at which we're supposed to be to reopen, correct?
Well, we did not set a rate to reopen. And in fact, I mean, the rate is only one of the metrics we're looking at. We're looking at three key metrics. One of them is the percent positive. Our percent positive has been at an all-time high, probably in early April, over 20%. Currently, at the low, it went down in the beginning of June to probably around 6 or 7%. It's been tracking upwards. It's currently around 8%. That's one of our metrics. And the second metrics we're really looking at is hospitalizations, because as you can imagine, we want to track our most severe cases as well as the capacity of our healthcare system to continue to function. This is critical as we reopen, and our hospitalization rates have been going up, although we still think that they are hospitals are able to function at this point. So there's a variety of different things we've been looking at, and we still think, we're watching this closely. We still see the numbers going up slowly. Again, this is not a surprise because we know there are millions of people now exposing each other out and about in the community, and we're just making sure our healthcare system has as capacity.
So the governor's joined in requiring us to wear masks statewide. Is there any enforcement at all of this effort statewide, and is there any enforcement county, citywide?
Is this a question for me? In the county, I think everyone is aware that we actually have very similar county orders to what the governor put out earlier this week or last week. Very similar. So we fully support the governor's orders, California's orders. We have been working on campaigns to ensure that masks are worn, that people are safe in the areas that we've slowly been reopening in a safe and staged approach. Can't speak for the statewide enforcement or in fact what the LA City is doing, but we have been working very closely with our different sectors through telebriefings, through education, through online materials, through media campaigns to educate the public on the need for face coverings as well as the safe ways to use face coverings.
So what you're telling me in a non-answer is, no, we have no enforcement.
Well, it's not no enforcement. Public health's primary role is not enforcement, as everyone knows. Our primary role is to keep the public safe, and this is generally done through education, through promoting our guidelines, through promoting our regulations, and we feel like we've been doing this quite adequately. As far as enforcement, we do enforcement when necessary. So, for example, when we have clusters of cases that are associated with a facility reported to, what I refer to as an outbreak, we will send teams of educated staff in, of experts, to assess the situation. If the issue is that people haven't been wearing face coverings, of course, we will enforce this. Depending on the nature, we can cite and fine facilities, and this has been done. It's not our primary function, again. We do this when we feel it is necessary.
I think one thing the city has to look at is whether we increase enforcement or even talk about increased enforcement and the possibility of citation. We haven't wanted to do this, but it's clear that people are violating this with relative impunity. I go out every once in a while for an exercise walk in my neighborhood, and it takes me back to my days playing halfback in high school. You see somebody coming on the sidewalk in one direction, there's a couple not wearing masks. You walk across the street to the other sidewalk, and there's more people without masks. You go into the street on one side, and there's somebody without a mask, and you go on the other side, and there's somebody coming at you without a mask. It's I wouldn't say almost universal violations, but it's probably 50-50 just from my observations. Where people have to, they will. So if they have to go to the grocery store and they know they have to wear a mask, they'll wear a mask. And grocery store employees, when they know they have to, they'll wear a mask. But we've seen video on news feeds of once the store is closed, the people that are restocking the shelves have runny noses and don't wear masks and wipe their nose and then continue restocking. So we see violations. I think we need to have a little bit more of a way to encourage compliance. I think we also haven't really seen a big public safety campaign. If it's there, I don't know. I mean, we have some basic graphs and information, and we reprinted in our our council office newsletter, and I'm sure other council members do too. So it lets people know that it's important, but it's still not doing the job. So the question is, can we look at getting help from influencers? Can we look at getting help from celebrities? Can we create a public safety campaign around this that is more inspiring to the people that are not complying? And especially targeting younger people who know they probably won't die from this, but they obviously have a good chance of killing off their grandparents and other older relatives and older coworkers. So can we look at actually funding a program like this? Can we seek out a pro bono PR firm to look at that? So those are some of the things I would like to see. I mean, I would consider things as dramatic as giving a warning that if everyone doesn't wear masks, we shut back down for a week, and then actually do it. And then when we reopen, people that aren't wearing masks will be more obvious that they're the ones that were responsible for shutting down the city of Los Angeles or the county of Los Angeles. Also, as we return to work, I know violations have been reported in the workplace among even our own city employees. And there are some that are concerned about going back to work because their coworkers are not masking. We've also seen the most public interaction between firefighters, between police officers and the public, and we know many of them are not wearing masks. And firefighters, as they roll out to an emergency, will get out of their ambulance not wearing masks, potentially infecting each other. Then they'll often put them on when they go to see the public. So I'd like to get a report back on what steps we could take to further enforce, what steps we could take to further utilize PR and trying to enlist people that have followings to push this, and also to look at requiring all city employees to wear masks at all times while they're at work. So I don't know if there are other things that we want to ask as well, but obviously we're long past the time when we've said, yes, you need to put on masks, but we've reached the point where we realize non-compliance is happening in large numbers, and a tool that could easily stop the spread in its tracks is not being utilized.
Thank you, Mr. Koretz. And I just want to, for the record, Mr. Corinne Price has joined our meeting. And Mr. Koretz, I didn't know you were going to ask so many questions, but before we get into questions, because I know my colleagues have questions as well, but I want to give the opportunity for, and those were very good questions, by the way. Many of them I wanted to ask myself, but I wanted to give the Tristan and Carmina to walk us through the report and provide us with a snapshot on where we are on the COVID-related infections, hospitalizations, and the synopsis of the governor's order. CLA, go ahead.
Hi, this is Tristan Nowak, CLA. I can give a brief overview of my report, which is obviously kind of dated at this point. Now it's about 7 weeks old. And I can't personally necessarily speak to the other things you requested, but hopefully Carmina can. So this report was started based on a series of motions from Councilmember Koretz that ultimately requested an overview of the CDC COVID-19 guidelines for wearing masks in public, existing ordinances in other cities, states, and countries requiring facial coverings in public, the city's enforcement options, and then there was an amendment from Councilmember Blumenfeld, if I remember correctly, about the safety and efficacy of masks with one-way valves. So at the time of this report, we were just reopening. We were in stage 2 of the Department of Public Health's roadmap to recovery and Mayor Garcetti's Safer at Home order. We were just reopening a bunch of businesses for curbside pickup and trailheads, parks, and golf courses. But as you know, recently there was the Mayor's Safer LA order, which is a bit different than the scenario was at the time of the release of this report. So while I was writing this report, I contacted LAPD about whether they were enforcing the already existing mask requirements at the time, such as the ones requiring essential workers to wear masks. And LAPD pretty much told me they were not going to be enforcing any mask orders, and they were going to be encouraging voluntary compliance, and that they were under the impression that this sort of sentiment was shared among law enforcement agencies throughout the state and country. And just some cursory research seems to make me think that that sentiment, or that's substantiated. It seems like law enforcement agencies across the country are not really actually enforcing any of the mask mandates. But also, I am privy to the fact that right now the city is reevaluating the types of things that we think it's necessary to have police officers enforce versus other agencies. And then so the CDC mask covering guidelines, pretty standard. I feel like everybody at this point has heard them or is aware of them. And I feel like at this point, if people are not wearing masks, that's like a conscious choice. It seems that people, at least even if they don't believe, so to speak, that masks are a good thing that you need to wear, they at least are generally aware that the government wants you to wear masks, and that the overwhelming majority of society is aware and knows that masks are good for reducing spread and infection. But so the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. And this is based on the plethora of research showing that asymptomatic and pre-symptomatic individuals are still able to spread the coronavirus. And so in discussion with CD5's office while I was preparing this report, they wanted me to focus the report on the County of San Diego, the City of Laredo, and the Commonwealth of Massachusetts. These have all obviously changed now, but one thing I'd like to highlight, for example, is like the City of Laredo is one of the first cities in the U.S. to have a comprehensive mask order like this. And then Governor Abbott, Greg Abbott, I think is his name, of Texas, sort of overrode the City of Laredo's mask order and said that it was unenforceable. But now in recent days, you've seen he's sort of made an about face and is pleading with people to wear masks again. But so generally, a lot of the mask orders are pretty similar. There are differences, and this will be sort of a reductive explanation. But generally, mask orders require that if you're going out in public, you should be wearing a mask. You should also observe social distancing. You should especially be wearing a mask if social distancing can't be observed. And then to the last 2 points, Councilmember Blumenfeld's amending motion regarding the one-way valve system. So I believe CDC notes on their website that there are certain masks with exhalation valves, and those don't accomplish the goal that is set out with everybody wearing cloth coverings. That is to say, an exhalation valve doesn't curb one's ability to spread the coronavirus, and the idea behind mask mandates is sort of predicated on the understanding that you're wearing a mask so you aren't spreading. It's not necessarily to stop you from receiving coronavirus. And then one final thing was a discussion that was had during the council meeting. Was, I believe, Councilmember Cedillo was raising potential issues of racial profiling for enforcement, which I think is quite prescient, and I think we're seeing that sort of being noted in a lot of mask mandates around the country. And so, to some extent, localities or jurisdictions are approaching this by saying, well, if you're afraid that wearing a mask will cause you to be profiled, then you don't have to. But of course, then the issue that creates a new issue where if people are not wearing the masks because they're afraid of potentially being profiled, it's still quite likely they're going to be harassed unfairly for not wearing the mask. So yeah, I suppose that's a brief overview of my report. I'm ready to field questions. Hopefully me or Carmina will be able to answer any of your questions, but if not, I will definitely try to find answers and get back to your offices as soon as possible.
Thank you, Tristan. Carmina, do you want to add anything?
Hi, can you hear me?
Yes, we can hear you now. Go ahead.
Hi, my name is Carmina de Santiago, and I work for the LA City Emergency Management Department. I'm the public health liaison to the Department of Public Health, and I've been assisting throughout this COVID-19 pandemic with the Department of Public Health and EMD as a communicator between the two. As far as the question of identifying causes for increased number of infections, I think Dawn would be the best person to explain that. Dawn, are you still on right now? I'm not too sure if she is on. There we go. Okay.
I'm sorry, could you repeat the question?
Yeah, of course. So one of the questions that they asked us is about the increased number of infections that we're seeing. And if we do know exactly where that's coming from, I know a lot of words have been going around because of the different gatherings that we've been having recently, also the different holidays that we have. Is that an exact correlation between the number of infections we're seeing, or is there other things that might be causing the numbers to increase?
So it's difficult for me to speak about the exact cause. This is true for any of the diseases we monitor at any time. We do track diseases, and as I think everyone knows, we started reopening the county in a staged approach, probably at the end of May, around Memorial Day weekend. And about 2 weeks later, we started to see our first increases. Now this tracks because we know the incubation period of COVID is 14 days. So this would make sense. Now, do we know the exact cause? Hard to say. But as we slowly reopen more sectors of the county, our numbers have been slowly going up. So if you're looking for correlations, we see correlations. Is that causal? No. And we are doing additional analyses. But as you can imagine, we're very early in this slight increase in the curve right now. So we have to, so it'll be a little while before we're finished with our analyses. I might ask, do you interview every case, and you do identify contacts and then in turn interview these contacts? So we are getting some data besides our usual, which is place of residence. We do have additional data about some of the higher risk exposures that individuals have. Again, it's a little early to talk about exactly like where these increases are showing up.
Thank you so much. And then also, I'm continuing to work with the Department of Public Health every week and every day just to communicate additional information that they may have to our emergency management department that may affect the procurement process or may affect what we're receiving as far as PPE supplies.
Thank you for that. And Dr. Terashita, is there anything else you'd like to add before we get into questions?
No, I'm available for questions.
Great, thank you. And thank you for that great presentation. And, I think the bottom line is, enforcement on wearing masks in public is challenging, to say the very least, and especially in light of the current social environment. So the basic practical question is, then how do we get people to wear these masks? So then I think that is what we're trying to solve here, because I think Councilman Koretz, myself, and we all agree masks are essential to public safety and to public health. But so let me ask a couple of questions. Has the governor or the state given any guidance or even resources on how they expect us to enforce or have public mask wearing throughout the state and throughout our city? Have they provided any guidance or resources?
So this is Dawn Terashita. I'm not aware of any guidance from the governor himself on how to do enforcement. The state has been providing guidance on the use of face coverings, additional guidance about COVID-19, but nothing specific about how to enforce.
Yeah, and no resources as well either, right?
Correct.
Yeah, no, and I think that goes to Mr. Koretz's point, besides announcements, and I know there has been some sporadic use of digital platforms and educational efforts, but are there more coordinated public health efforts to encourage residents to wear masks between the county, the city, and the state?
Well,
anyone can answer this one?
Well, this is Dawn Terashita. I'm not aware of specific coordinated efforts. However, we are all following the same guidelines, and we are all trying to promote this in an effort for public safety, of course. And as I mentioned, LA County has been doing a number of different educational campaigns, which, I hope have been seen and effective, including social media campaigns, putting up educational documents on our website, regular media campaigns, that sort of thing.
Yeah. And I think there was a little bit of conflict in messaging way early on during the pandemic regarding masks, because clearly the N95 masks that medical professionals use are the ones that are 95% filtration rate for all of the viruses. However, cloth mask wasn't 95% filtration rate, but at the same time, it was clearly proven in other countries that it works. So in the beginning, I remember early on during the coronavirus pandemic, many people were saying, or many public health officials were saying that the cloth masks aren't as effective or will not work, and I think that might have still filtered in. So, so the bigger question is, clearly there's enough research and statistics and science behind it and data to show that wearing masks indoors, especially in when people are a little bit closer than 6 feet, is clearly makes sense. But can you comment, Dr. Terashita, can you comment on the actual the studies or science behind wearing masks outdoors? Because I know some people feel that if you're 6 feet away, you're fine. So can you kind of go over some of the science and the data?
Yeah, thanks for that. This is a very complicated issue, and I know it's been discussed since the beginning of COVID, but COVID is a new virus. It's a novel virus that our human population hasn't seen before. So a lot is unknown, and unfortunately that's just how it is because it's a novel virus. And research studies take a while to set up. We have started seeing some data coming out of China and Korea, some of the Asian countries that were hit first with COVID-19. They're generally smaller studies, again, because this is a very novel virus and it just started a few months ago. I hesitate to just speak about face covering use alone because it's really just one of the tools that we have to prevent COVID-19. Most of the studies that are done, in fact, don't just focus on face masks. It focuses on a few of the things. It's not face masks. We actually call it universal source control. The purpose of a cloth face covering is to control the person. So in other words, it prevents others. It doesn't protect the person wearing the cloth face covering. It protects others. It's a source control. If that person has COVID, it's controlling that source. And other measures are physical distancing, which some of the papers coming out show physical distancing of keeping greater than 6 feet away. This is actually the most important factor because it makes sense. If you stay within 6 feet away from others, you're not going to get droplets. Droplets are spread generally on average around 3 feet, but 6 feet to be safe. Also, infection control and keeping the environment clean. These are key measures that we have to also promote, not just the cloth face covering. But initial studies have shown, as you mentioned, that cloth face coverings are protective. I don't know how much I trust these initial studies alone, but we do feel like it makes scientific, theoretical sense, so we have been advocating quite a bit. It's a barrier. It's blocking your droplets from infecting others, and we do support the use fully.
Thank you for that. Before I turn over to my colleagues, I do have just two more quick questions. So, has the city or you talked about earlier about infection rates going up, especially during lots of mass gatherings. I read several reports that said that many of the protests that occurred there has not been seen a spike in coronavirus infections. And then I read something again today where there has been an increase amongst young people. Can you kind of comment on that? I mean, because the incubation rate is 14 days, like you said earlier, but so should there be a spike, or is there a spike, at least locally?
It's hard to comment on the protests. I think we've all seen the news and saw pictures of mass numbers of people together at the protests, many of which were not social distancing or wearing any sort of face covering. It's something that has to be studied, and honestly, we have not studied these protests. In order to fully understand if the protests themselves were a risk, we would have to be conducting rigorous scientific, group studies, looking at cases versus controls, people who were there who did not get sick, looking at all the risk factors involved, like mask use and distancing and all these things. And we have not done those very detailed studies of protests to understand, do people get infected from protests? However, I mean, it makes a lot of sense, right? It doesn't take full understand if this many people are together in unsafe conditions that they would be getting exposed and then subsequently infected with COVID. That may have contributed to some of our younger people, the increase in numbers. I know you said the word spike. I don't think I would say we have spikes in cases. Spikes in cases really implies like a certain baseline number that all of a sudden increases in exponential numbers. We're seeing an increase, like it's a slow, steady rise of the hill, a slope of our epi curve. So I don't think we're seeing spikes in young people. We're seeing increases in young people, and it could be due to the protests. We do see studies coming out from some of the early gatherings, large gatherings in COVID, like from a religious ceremony in Korea, from some of the East Coast conventions, where we definitely know these type of large mass gatherings are risks for COVID-19. So it wouldn't be a stretch to say that our protests contributed to that.
Well, and I think that's part of it. We've seen a steady increase, but because there is not a tremendous amount more increase of, and thank God for that, but it's making folks feel that even amongst this protest, just the fact that people wear masks, and even they're in close proximity, that they won't be infected. So it's not really helping our cause to try to make people follow the various orders. But the last question before I turn it over to my colleagues, can you just clarify the indoor and outdoor designations in the governor's order? Because I asked this because I've had a number of issues in my district where individuals are not wearing masks in common areas of large multifamily buildings because they consider it as being part of their inside of their home. And building managers have been reluctant to help enforce that order. So can you clarify indoor and outdoor designations?
I'm not 100% sure I'm understanding the question, but so you're saying that if people are within their
So if you're in the privacy of your own home, obviously, clearly, you don't have to wear a mask because you're in your home. But if you live in a apartment complex, many people are considering, is the hallway considered still indoor, or is it considered outdoor and therefore subject to you having to wear a mask based on the governor's order?
Okay, yes, I get it. Well, this has actually been a confusion both with the governor's order as well as the LA County order. So the gist of it is if you are with your family unit, like your household unit, you don't have to wear a mask. These are the people you are with constantly. They live in your household. You share more than just airspace. You share all the environment you touch constantly. So you're within your household unit, you don't have to wear a mask. Anytime you anticipate you possibly could come in contact with someone who's not in your family unit, you should be wearing a cloth face covering. This includes hallways. This includes walking down the sidewalk. This includes if you're on a hiking trail. If there's other people around and you might come in contact with them, you have to have a mask. So we're telling everyone they need to keep a mask in their pocket whenever they're outside of their family unit abode, in case they come into contact with someone and they have to quickly put on a face covering. And we've been very strict when asked questions about this. Again, even hiking trails, even sidewalks. But I think the gist of the governor's order distinguishing between indoor and outdoor is really because of the issue of risk. Since indoor is a closed room with closed airspace, it is a higher risk for COVID-19 transmission than being outdoors. So there is a sense of a little bit more safety outdoors and less risk outdoors. That being said, we are very strict. If you might come in contact with someone who's not in your family unit, not in your household unit, you have to wear a cloth face covering.
Okay, thank you. Mr. O'Farrell?
Yes, Mr. Chair, thank you. And Mr. Kretz, thank you for bringing this up. I think when you introduced the motion, you're at the height of uncertainty and heading into the whole national divide of masks and no masks. And what has occurred in the last several weeks is whether it's in so-called red states or blue states, that the spikes in coronavirus have not respected any political ideology. Therefore, science wins yet again, like it always does. And as a believer in science myself, and knowing some of the data that we were just given by the county health department and others in the city, we know that the data is always being refreshed, updated. We're learning more and more about prevention and precautions and the best way to protect ourselves. And one bit of data that came out of the CDC, I think just in the last few days or so, is in relation to coronavirus death rates versus the flu death rates from a year ago. One of the things we hear from folks who have not informed themselves of the risk of coronavirus is that it's just like the flu, or I have my rights and I have my liberty, so this is just a fake media sort of attempt to fool Americans into believing that this is something that we should take more seriously. Well, again, the science speaks to that, and we know that the death rate from the flu is 0.1%. The death rate of coronavirus is 4.9%. In other words, it's 49% more deadly than the flu. So this is not in any way, shape, or form comparative to the flu. And the flu, actually, every year there is a vaccine that is largely effective to combat the flu. And to make matters worse, coronavirus, of course, there's not yet a vaccine. And we know that the whole world is in a mad dash to create one, but there's not one yet. And effective treatments aren't so widespread and are very limited right now. So we've learned a lot. We continue to learn a lot about how deadly COVID-19 is. Something else that's happened in recent weeks, and even more recently last week, is we know that around the same time this motion was introduced, the mayor signed an executive order requiring face masks and coverings in public. And then, of course, now it's a statewide requirement from the governor. So I think that encouraging compliance is one thing, and I think that it's great to explore and really push for how we can do that more effectively. But it's very different than creating an ordinance requiring people to wear a mask or they break the law. And that's a very serious and ultimately perilous, I think, way to go, because then you are literally criminalizing someone who isn't wearing a mask in public, perhaps taking a walk on their street all alone and they don't have a mask on. Could they be stopped? And so I think that if creating an actual ordinance for requiring face coverings is a bit of an overreach from the way I look at this, especially since we're under the mayoral and governor's orders, making it a requirement across the city and the state of California. It's something that we should take a close look at. But in my opinion, there are risks of that overreach piece. And I think it was Marquis Dawson and Mr. Cedillo both talked about the real danger, especially on top of COVID-19, with the whole incendiary issue of racial profiling, and that we certainly don't want to bring that subject into this arena. So I think the way to go is encourage compliance, keep up on that, and keep making sure that we educate folks on the science of COVID-19 and the risks, the inherent risks involved, and how when you wear a face covering, it's not about protecting yourself from it necessarily, but it's about protecting others. So that's kind of where I am on this. But I want to commend Mr. Koretz, you for bringing this up because of the incredible dangers. We're still in the first phase of COVID-19. This is still the first phase, and if we're really, really lucky, it'll die down as the summer months progress. And if we're really, really lucky again, there will be not so much of a serious spike in the fall. And that's if everything goes well. But on balance, I think encouraging compliance is better than adopting an ordinance in relation to face masks. Thank you.
Thank you, Mr. O'Farrell. Mr. Price, do you have any questions?
Yeah, just a couple. First of all, thank you for your leadership on this, Mr. Chair. I know you and Mr. Koretz have been sort of sounding this alarm for a long time since the pandemic was really upon us. And I'm concerned. I'm also concerned about the increase. We call it an increase, call it a spike, call it a rise, whatever it is. More and more folks are getting the disease and are dying. and the numbers will be good in communities of color, especially here. We've been relatively lucky, but any death is one that we don't need. So I agree. I think we got to strongly educate, encourage folks to wear masks. I mean, it's one of the tools that we have. We know that you're talking about young folks. We know that they're not wearing masks. Has been evident by the increase, and they're not getting tested. We are encouraged both because it's just extremely important. So I just think we should be encouraging, motivating, certainly informing, educating, and I'm even almost willing to say fine, but charging assessing the fine. I wasn't there. Not totally there now. I certainly wasn't there last week, but I tell you, man, as more and more folks are infected, impacted, more families are in turmoil because of this disease, this virus that we still don't have a vaccination for, right? We still don't. Hopefully we'll have it this year, sometime into this year. But in the meantime, folks are dying. Folks are dying. So I'm not as concerned about profiling. Folks, racial profiling. I am concerned about the deaths, and so I'd rather, err on the side of making sure folks know it's important to wear a mask, and certainly exercise, social distancing, and the other tools that we are encouraging. But I think increasingly this is becoming a matter of life and death. I think it's low-hanging fruit, and so anything we can do to encourage, motivate, inform, and even maybe ultimately find those who don't want to wear a mask, I think we should be at least exploring those opportunities. So, thank you, Mr. Chairman. That's all I have.
Thank you, Councilmember Price, and yes, I agree with the fact that and one thing is, irrespective of what we do here locally, it is already mandated and it is law in the state of California for all the cities, all the counties, where the governor has stated that we must now wear masks in public. So that is now the key is how do we make sure it gets done, whether it's through coercive measures or whether it's through some sort of persuasive measures. And then I do want to also comment on what Councilmember Mitchell-Furrow said earlier about the 4.9% mortality rate for COVID. And by the way, that's 4.9% of those that we know are identified as COVID. Because as we've seen in the various articles, all the infection rates and mortality rates are based on what we know are COVID. There's still that huge backlog of people who have not been tested, who don't have access to tests, and various deaths that are not yet attributed to COVID, even though they're highly suspect. It's because CDC has not been able to get around to get to testing them. So at the end of the day, we might even see this 4.9% even go higher. So I want to reinforce what Councilmember O'Farrell said. And I know, Councilmember Kurtz, do you just have a additional recommendation, or do you have questions?
Questions and comments and information. So we checked LA County's report last week, and the governor set the rate of 25 cases per 100,000 to reopen. LA County's report last week said we have 211.1 cases per 100,000. So we're almost at 10 times the number of cases that we should have to be reopening. And LA County's numbers are better than the state's numbers, which are higher. So that should give us a lot of pause. Also, I think Mr. O'Farrell accidentally understated one of his statistics. He gave the numbers that show how much more deadly it is than the flu, but using his numbers, I believe, rather than 49% more deadly, it's 49 times more deadly, which would be, I believe, 4,900%. So this is considerably more deadly than the flu. I'd note that whether we...
You're right, Mr. It is 49 times more. where I messed up was 4.9%, but it is 49 times more deadly. That's exactly right.
Which, for anybody that claims it's like the flu, that's an astonishingly higher rate of deadly results. With the mayor's action, whether we pass an ordinance or not, it's been in effect. And the concerns that people had, we've heard a lot of concerns in almost every arena about communities of color and how they're treated and how law enforcement reacts. I don't know that I've heard a complaint anywhere about law enforcement relating to enforcing a universal mask requirement. So I would say the concerns that were expressed did not turn up. The concerns that I continue to have are that COVID is spread much more widely and certainly deaths especially more widely in communities of color and the black community in particular. And so if anything, I would not discourage wearing masks for the other concerns that people had. I would encourage it in that community especially. It's hard to determine what's exactly causing the spike, but the timing is both related to demonstrations and reopening. And the fact that I would say many more people that participated in the demonstrations were younger, and many more people that participated in the opening were also younger. And the fact that we are seeing more of an increase among younger people, I think, makes sense in that regard. The positive is that while we're seeing what I consider a spike in spread, we have not really seen a spike in deaths. And I think part of that is because we've gotten the word out that if you have underlying conditions, if you're 65 or older, you're particularly vulnerable to death. So folks in that category are being more careful. A number of those deaths were in nursing homes. We're implementing better protocols. So we've been able to reduce deaths per case. But at some point, younger folks will interact with their older relatives, and we will start to see that impact as well. One thing that I've noticed in some of the things I've read over the months is a question about social distancing, and that 6 feet is enough if you're just normally breathing and standing in a spot and talking to a neighbor. But if you sneeze or you cough or you yell, droplets could go more than 6 feet. But if you've seen some video of folks wearing cloth masks and in the right lighting so you can actually see the droplets being expelled, you'll see that if you wear a mask and you sneeze, droplets don't go more than 6 feet. But if you're not wearing a mask, they definitely could go a longer distance. So the perfect way to almost completely avoid spread is, one, not to stand with others nearby for a lengthy period of time, but also to both social distance the 6 feet and wear a mask. It's very hard to spread droplets more than 6 feet with a cloth mask. And so if we are able to somehow get people to understand that social distancing is still necessary and a mask is more necessary than ever, I believe we would see an immediate drop in the number of cases, even as we expand. So the question is, how do we convince people to get there? And particularly, how do we stop city employees from not using masks? Because while enforcement of the general public might be more difficult, enforcement among city employees should be relatively easy. You're told not to go in public without a mask. If you're an employee and you're doing it, you're insubordinate. And there are steps of discipline that can take place. So I think that at least having the source of spread not be city employees and having the bad example not be set by city employees would be a big first step in the right direction.
Thank you, Mr. Kretz, and I will be including that in my motion. And if that concludes all the questions and comments from colleagues, I would like to have a few recommendations. The first recommendation is I want to note and file the CLA's report dated May 11th, 2020. But that does not mean it's going to stop, because we're going to continue this discussion, because I would also like to instruct the CLA with the assistance of the Department of Building and Safety, Bureau of Street Services, the Emergency Management Department, Department of Recreation and Parks, and the Department of Public Health as needed to report back in 30 days on current enforcement protocols to wearing masks in public and any recommendations for enforcement, including the issues of citations in outdoor public spaces going forward. As Councilmember Koretz suggested, I want to also move that the CLA report back in 30 days on requiring all city employees, including the proprietaries, to wear masks at all times until the end of the crisis to protect them and to protect each other and to protect their constituents and visitors. And this is in city-owned buildings, city properties, indoors. Next is instruct the CLA with the assistance of the CAO, EMD, EWDD, with the assistance of DPH as needed to report back in 30 days on the development of a coordinated public information campaign with the county and the state, as well as any other jurisdictions, to encourage residents to wear masks in public, and the feasibility of contracting with a public relations firm to manage a campaign, and any financial resources available, including the CARES Act funding that could be used to support the campaign. Additionally, I would want a report back on any type of equity programs for disadvantaged communities when it comes to citywide mask wearing programs. And lastly, report back on what research on transmission of COVID are currently underway, and a synopsis of those. So that's it. Colleagues, are there any questions or comments? Seeing none.
Mr. Chair, could I add one comment?
Sure.
On your suggested motion on the city employees, I'd like to suggest that we include both indoor and outdoor wearing of masks, because one of the problems in terms of both spread and a bad example is city employees that are currently not wearing masks outdoors in their interactions with the public.
Okay. Do I need to read that over, Mr. CLA, or can we just add that language in for both? So it'll be for city employees wearing masks indoors and outdoors at all times. So, and these are all report backs within 30 days, so we could get more information and progress this forward, because as we do know, as we prepare for the second wave, we got to remind ourselves, first wave is still here. It hasn't gone away. It's still with us, and it's steadily increasing. And one comment which I didn't get to include earlier was I wanted to report back on the research, because there are research being done, like at UCLA with Dr. Anne Remoyne, where they're trying to actually study the transmission rates, especially in first responders, to better understand how this virus spreads. So, with that said, Mr. Clerk, can you please take a vote?
Yes, sir. Councilmember David Roof.
Aye.
Councilmember Mitchell Farrell.
Aye.
Councilmember Karen Price.
Aye.
It's approved as amended, sir.
Great. Approved as amended. And do we have any additional business that we need to take care of?
That leaves the desk, sir.
Great, thank you, and colleagues, thank you for attending, and this meeting is adjourned.
Recording stopped.